So let me welcome everyone to the Aspen Institute. I want to thank you very much for joining us this morning. I know it's very difficult on a Monday morning, but thank you. It's a testament to Dr. Sania Nishtar that we have gathered such an interesting group. Before we begin, I would like to also, I have many special thanks, but a very special thank you to my colleague and friend, Chris Balderston, who is here representing Secretary Clinton. Chris has just arrived from Tunisia over the weekend. We have, as everyone knows—
Last night at 8 o'clock to be exact.
Well, you know, Chris used to be a young guy, but now that he's doing this public-private partnership, he is aging.
Used to be a black beard, now it's
Exactly, exactly. But Chris is here not only because of his deep and abiding commitment to Secretary Clinton and to the whole concept of public-private partnership, but he met Dr. Nishtar, I believe, at the Clinton Global Initiative last year when we were together at CGI. He was as dazzled with her as I was. And Sania, you have been not only a thought leader for all of us, but you have inspired our work. And as we work on the Partners for New Beginning here at the Aspen Institute, you inform so much of our thinking on what it means to have a public-private partnership. And you have led all of us in thinking outside the box, in using all of our collective thinking to put in that toolbox new ideas and to leverage resources, which is the essence of today's public-private partnerships. We are keenly aware that Pakistan is facing enormous challenges. But I think that as Pakistan faces the day-to-day challenges, Dr. Nishtar is facing them with such imagination and creativity, but she is also creating a framework and helping us in the partnership that we have in the context of Partners for New Beginning, which is chaired by former Secretary of State Madeleine Albright, Mukhtar Kent, the chairman and CEO of the Coca-Cola Company, and Walter Isaacson, our president and CEO of the Aspen Institute, to help recognize that healthcare and the special challenges that Pakistanis are confronting day to day are particularly not only important, but require all of us to think outside the box, but to act outside the box. And it is something that I have taken very seriously. And everyone who has had the honor and privilege, Sania, to work with you, to understand what Heartfile is about, comes away saying, I need to do more. But let me ask everyone to really, as we think about and engage today, that we think about how we can partner with you, how we can help support you, and how we can leverage our thinking, our resources, our collective networks, because we all have challenges, but I think that your framework and Heartfile is extraordinary. And I thank you for all that you do. I thank you for being a partner with us in Partners for New Beginning. And it is an honor and privilege for me to welcome you here today to the Aspen Institute.
Chris, Tony, co-panelists, friends from the Pakistani diaspora community, colleagues, ladies and gentlemen, let me begin by thanking Tony for inviting me here, for her very gracious hospitality, for words that have truly humbled me. Ever since I came into this very privileged network of the Partners for a New Beginning, I have been so deeply touched by the commitment of the American people and the American government to extend a hand of friendship across the world to Muslim communities, to Pakistan in particular, for their goodwill and camaraderie. And I speak here as a member of the Pakistani community first, and as Sania Nishtar, and as somebody running Heartfile secondarily. I'm so deeply grateful to you for your efforts in trying to ease tensions between our two countries. I'm so deeply touched by your efforts to foster proactive collaboration and goodwill in a deeply globalizing world where relationship between these two countries are so important to global peace and well-being of people. And it was within this context, this broad context, that I'm so deeply appreciative of the support that you're giving to Heartfile and to me, and the mentoring that you provide, Tony, and the consistent support that I have from this end. This initiative, this meeting today has a particular purpose, and we will come to that purpose. I will have the privilege of introducing the leaders who are supporting me in this effort, and of others that I hope to engage before we wrap up today. My sense is that we're beginning with a documentary which will bring you a real-life flavor of what goes on in Pakistan, and then it will help put things in context as to why we need solutions out of the box and why we're looking towards actors outside of the government to do something substantive in the field. So we will come back to all that. But with this, I hand the floor back to you, Tony, to take us through the next steps. Thank you very much.
Thank you very much. Before I introduce the brief video that we're going to have, I did want to just give everyone here a little bit more granularity on Partners for New Beginning. We have included in your material background information, but Partners for New Beginning is a network operating now in 10 countries around the world where local projects and priorities have been identified by local chapters. Here at the Aspen Institute, we serve as the secretariat and strategically match these projects with U.S. and international partners. PNB is supported by a global coalition of prominent business and civil society leaders committed to building effective partnerships in the areas of economic opportunity, science and technology, education, and exchange. Health, exchange, and entrepreneurship have been identified as priority areas by our PNB Pakistan local chapter. And I think it's really very important to underscore the importance that Partners for New Beginning is driven by the philosophy of locally owned, locally driven. And Sania is a testament to that. So at this point, I would like to introduce the Heartfile. Do you want to do the video first? Okay, so if we could please have the video so that you will have the opportunity to have a background and better understand the Heartfile project. Sania, that video is extraordinary and really speaks volumes about Heartfile. And as you said, the need for financing and the crushing reality that so many in Pakistan are unable to access the extraordinary private health care, but the crushing needs of the public sector and how you have met those needs. It will lend itself to rich discussion for this morning's conversation. Would you like to introduce your colleague?
I'm sure everybody has questions, and I will explain what the broader context of this initiative is subsequently. But today we are privileged to have a very eminent panel, and I'm very pleased to introduce three of the people who have committed themselves to come into the Leaders Network in support of this initiative. And the first person that I'd like to introduce is Sir George Elaine. Sir George needs no introduction. He's Director Emeritus of the Pan American Health Organization and a father figure for us in public health. So Sir George, the floor is yours.
Thank you very much, Sania, and good morning to you all. Good morning. Ah, that's better. I am pleased and relieved to be here. I thought Sania would never invite me to anything again. The last time she invited me, you remember, I was in New York.
Yes, I do.
And I got lost. I was very, very late. But luckily, my office is down the street, so I was able to get here in time. I would also like to thank Aspen for hosting this. And you've exposed us, really, to partners for a new beginning, of which I knew nothing before. So thank you very much for that. A very, very interesting and I would think a very stimulating experience to know more about partners. I wear many hats, and I'm not really unfamiliar with diplomatic roles. I was UN Secretary General Special Envoy for HIV in the Caribbean until a little while ago. I carry my country's diplomatic passport, and I have the rank of ambassador in the Caribbean. But one of the titles I wear most proudly is that of ambassador for Sania Nishtar's Heartfile Leaders Forum. And I hope to stimulate some of you to be equally enthusiastic about the forum, the financing, and the fund, the 3 Fs. Ambassadors are usually government representatives in a foreign capital, and they represent their head of state. I don't know Pakistan, have never visited Pakistan, and perhaps I don't need to know Pakistan physically, as I know the person who, in a sense, is my head of state, that is Sania Nishtar, with whom I am proud to be associated. I have enough information from my head of state to be enthusiastic about supporting her and the Leaders Forum, and more specifically, Heartfile financing. I know about the situation I should represent by speaking to Sania, participating with her on various committees, reading her work, and even publishing with her. I'm not going to dilate on her brilliant academic career, her research, her work on health reform in Pakistan, or her elegantly crafted book, Choked Pipes, which I would recommend to all of you for reading. And I won't ask you to put up your hands, those of you who haven't read it yet, but I recommend you go onto Amazon.com and get it and read it. And this describes the mixed system and describes the things that clog the system, some of which you have heard, and make the system unresponsive to the legitimate needs of the people, especially the poorest of the poor, and the needs for essential health care, as you've heard from the video. No doubt, Sania will go into more detail about Heartfile health financing, and I urge you to pay close attention. I hope you have captured the scenes and the images and the poignancy represented in the video that was shown. I certainly have captured through images like these and through word pictures that she has painted the plight of those whom Heartfile financing has helped and will help. She's told me about the 25% of the population living before the poverty line. She's told me about the fewer than 25% who don't have health coverage. And I'm struck by the boldness of the approach to trying to help these people. It seems an insuperable task when you think about it, but I am struck by the boldness of the approach. I'm struck also by the use of technology, which is being used to bypass the corrupt and the inefficient, and impressed also by the care, the sensitivity, and the efficiency with which it is done. I'm also very struck by the applicability of the financing mechanisms to all forms of illness, including the chronic diseases, which also can drive people into poverty and stop them from escaping the poverty trap. One just has to look at the cost of treatment, for example, of a child with cancer, something that is eminently curable in this country, and realize that in our countries, this can really bankrupt the family, or even a well-to-do family can become poor, having to deal with one of these diseases that are eminently treatable, eminently treatable. This is not the only occasion I'll have to talk about this. On the 25th of this month, the Clinton Global Initiative, we'll have a chance to talk about how partnerships in many forms, public-private partnerships, intersectoral partnerships, multisectoral partnerships, can go a long way to try to, if not solve, mitigate, alleviate in our lifetime some of the problems that have been displayed so elegantly on the film, of which Sania will speak in more detail. I know Sania won't like me to say that she hopes that the dissemination of her experience with Heartfile financing and the Leaders Forum will change the world. I know she wouldn't like me to say that. But when I think of the potential it has, when I read about it, think about it, and talk about it, I am moved to think of Margaret Mead's, Margaret Mead's famous quotation, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." So I hope some of you will be moved to become members of that small group of people who will help Sania really to change the world. Thanks very much. Good to be here.
Thank you.
Sir George, extraordinarily eloquent and poignant and focused. I really am very, very impressed with your thoughts, and you have captured the essence of Sania's work. And Sania, I didn't mean to take the microphone from you, but you are usually not willing to acknowledge the boldness of your thinking, and I think Sir George has really captured that so well, and I've made some notes, so thank you for doing that on behalf of Sania. It's really quite remarkable. May I, since we're talking diplomacy, I think it would be appropriate if we could ask Chris, and also public-private partnerships, if I may do a formal introduction of my colleague, Chris, who is Special Representative for Global Partnerships. And full disclosure, he has other partnerships which are secondary to that of Partners for New Beginning in his portfolio, but other partnerships he has indeed. But I am very privileged that he has spent so much time and effort in the Partners for New Beginning undertaking. I think it speaks volumes about Secretary Clinton's interest in this area, but Chris will elaborate on that. So Chris, welcome, and thank you for being here with us. We really appreciate it.
Thank you, Tony, thank you, PNB, thank you, Gabe, wherever Gabe is, there you are. And I want you to meet Glenn Delakian from our office, and yes, Sarah to wave if you need us in any way. I just wanted to be quick and tell you, I wish when we came, I've worked for both Clintons for 18 years, and I've worked for Secretary Clinton for 11. I often say that nobody else will give me a job. That's why I stay there. But yeah, that's right. I always joke that the theme of the Clinton campaign was always don't stop thinking about tomorrow. But I often think it's the Hotel California. You can check out anytime you like, but you can never leave. But I wish when we created this, the Secretary wanted to bring people together, the power to convene, to bring people together, to talk, to do partnerships. This is the way of the world. And I am not at all tired after coming back from Tunisia last night, seriously, because this was, when you get out there and you talk to people, it is just energizing. And I have to tell you, if ever I always thought PNB was a good idea, but after being in Tunisia, I really think it's a good idea because we're bringing together activists at the local level. And I wish I knew when we started our project what I know now. And I wanted to just give you 6 quick things we've learned and why I think Heartfile is so emblematic of each of them. 1, empathy. I think we're afraid to talk about empathy in this business. We try to be very you know, we monetize everything. We want, what's in it for me? Where's the altruism? But I think empathy is huge. And I think your idea of bringing, of texting back to the contributors what's going on has, you know, I never thought of that, but I remember when we did meet, and we actually met in Istanbul at the PNB conference, you know, to keep bringing your network together, texting is a very important thing. So I really do think empathy is underestimated in this whole field of partnership, but it's much needed. People are not going to give money, are not going to give passion, are not going to give you, hand over their values unless they feel they're a big part of it. The second thing, Sir George mentioned the word bold, which Glenn will laugh, because there is not a time when I don't talk to a group, when I don't mention my favorite president, Franklin Delano Roosevelt, in the depths of the Depression, when he said, we need to partake in bold, persistent experimentation. Read his speech at Oglethorpe University in 1932. It could be, President Obama could have said the same thing. But bold, persistent experimentation. If it does not work, then get rid of it. If it works, scale it. Do something with it. But you know, I think what Heartfile's done, they have proceeded with a bold, persistent experiment. And we have become risk averse in industry, in government, in NGOs, in our own lives. I'm not telling everybody to go out to be risky, but I think it's very important. We have to innovate. We have to, this is what, you know, excuse me for being a bit patriotic, but this is when we go to Tunisia and we go to other parts of the world, this is what they want to hear about from Americans, innovation. They want to hear about the things we're doing. You know, partnerships are not just writing a check. They are actually, you get out there and they want you to, you know, they want access to your networks, they want access to your technology, your innovation, your ideas, your values, and we have to do more of it. Third thing, my friend here, the importance of diaspora. You know, it is hard to believe that we went, you know, over 200 years in a country that's known for, you know, being a nation of immigrants. It took us 200 years until over 200 years for the Secretary of State to have a global diaspora forum last July. And we're going to have our next one at the end of this July. And if you're interested, talk to Glenn, because we just sent a note out, I think, at 8:30, and at 8:34 we had 5 people sign up already. But the Secretary asked us, you know, she saw the power of the Irish American community with the Good Friday agreements. We never would have had the Good Friday agreements if it wasn't for the Irish American community diving into this. She'll often talk about, I can't talk to the foreign minister of these countries. We have to keep talking down here, civil society. And we, you know, I think you'd admit that I think Richard Holbrooke and Hillary Clinton helped start, or helped, you know, motivate this, the American Pakistani organization. And what we're doing, we have 62 million Americans who are first and second generation in this country. They give $92 billion, look it up in the Hudson Institute report a month ago, in remittances. And we don't want to touch remittances, but we want to start aggregating remittances to do good. And one of the things that we've come up with is a bold, persistent experimentation. We call it the IDEA, the International Diaspora Engagement Alliance. You could look online at it, and it's something where the public sector, the private sector, the NGOs, the academic communities, the diasporas come together to try to solve problems, and we're getting that up and running, and you should take a look at it. The fourth thing I would mention is a recognition that partnerships are not easy. You know, I often joke, it isn't getting in a room and singing "We Are the World" and everybody, you know, it's not a soft thing. It's smart. Secretary calls it smart power. It's a serious business, and you look at your statistics, you know, and the finances behind it, and I think Heartfile has really emboldened that. The fifth thing, locally driven. We saw this in Tunisia. We didn't go into Tunisia when PNB went in with Tony and Vanessa and others and Mickey and say, this is what we think you should do. We're departing from the past. What does the local chapter think we should do? And I'll tell you, we had 3 days of going around and talking to local chapter people, finding out how we could link our innovation. And again, I think Heartfile is a very good example of that. And lastly, building trusted networks. You know, you're never going to get anything done until, I call it the conspiracy of the good, but I don't think that flies at the State Department. But, you know, Elizabeth Avery at Pepsi has been a trusted partner on a lot of our partnerships. Georgetown University helped us run our Impact Investing Conference last month at Georgetown. There are trusted members of the partnership here. And, we have to figure out ways, and I'll tell you, this is hard, because we're trying to do it. We have a database of thousands of trusted partners, but you got to get to the bottom line with people. They're not good. I love altruism, but unless you can show people what's in it for them, they're not necessarily going to dive into it. And so we have to build these trusted partnerships so that we can expedite addressing these issues quicker. We have to have people in all these organizations that subscribe to this partnership idea and want to keep moving and working. I didn't mean to give you the long spiel about our office, but I really came here this morning because I think what Sania is doing with Heartfile is just emblematic of all of those 6 things that I just talked about. And, we have to encourage this bold, persistent experimentation. We can't sit and make the perfect the enemy of the good. I shouldn't say it, but I was at a forum, somebody said, we got to go slow on partnerships. We don't know enough about it. No, we don't. Let's dive in. Let's try things. Let's celebrate what's working. It may not be perfect with what you want to do, but talk to her and figure out how we could replicate this. Thank you very much on a Monday morning. I appreciate the time here.
Chris, very, very well said. I agree with you. This isn't easy work, but we have to stay the course, and we do need to be bold. You said it extraordinarily well, and we have a great example here of someone who has been bold, whom we need to step up to the plate and support in every way we can. Sania, I'd like to ask you to introduce the other panelist, if you would, please.
Our next panelist is Uwais Khan, who's a very dynamic young man. He is the CEO of the American Pakistan Foundation. And when the foundation was conceptualized and put into place, people were very skeptical about what it was going to achieve. But I can tell you, within a very short span of time, he has done remarkably well. And last month, or was it the month before the last, in partnership with USAID and the State Department, he was able to put in place a very innovative public-private partnership and a vehicle for funding, which involved a collaboration between the private sector and a bilateral entity, which is very unique and innovative by innovative financing standards also. He has been a great supporter of our work and indeed of many initiatives in Pakistan, and I'm so pleased that he is here from New York. Uwais, the floor is yours.
Well, thank you, Dr. Sania. I'm humbled by your remarks. I want to thank Tony for actually hosting us here for Aspen Institute, for bringing us here. I'm on behalf of the American Pakistan Foundation, I just wanted to say that Dr. Sania's initiative is one of the most inspiring initiatives that we have seen for quite some time. The American Pakistan Foundation, as Chris mentioned, was launched in 2009 by the efforts of Secretary Clinton and Ambassador Richard Holbrooke and the leaders of the Pakistani American diaspora. We look at credible social economic initiatives and provide or galvanize resources for them. Prior to my role at APF, I also used to be in venture capital. So we used to look at problems. Speaking of innovation, we used to look at things which are very disruptive, very innovative, and can address problems on a large scale. So I'm going to get a bit into the sort of the why we think this is one of the most interesting solutions is. So Pakistan, as all of us know, it stands at profound crossroads. It has massive economic and social issues. You look at education, 1 in 10 kids, I think, who don't go to school are in Pakistan. And then you look at healthcare. You look at other massive social economic issues as well. So I think when you look at the macro scale, I think it's important to see what are the solutions that would address that are scalable solutions, which could be innovative, could be scalable, and could address a large population. And we started looking at healthcare, and I think that is one of the things that was quite interesting to us, that it was very easy for service providers and healthcare I would say professionals to actually sign up to the system, and from a donor's perspective as well, it was very easy for to go all the way back to the patient and see, who has gotten taken care of by the system or not. So it was really this unique sort of innovation that attracted us to this initiative. And we've known Dr. Sania for a while, and I've personally sort of visited the hospitals where the patients are actually getting treated, and seen sort of the remarkable work that she's doing. So I'm just here to sort of express our full support for this program, and we as members of the Pakistani diaspora are willing to lend as much support as possible to this initiative, because I think it's very unique, it's very innovative, it's very disruptive of the current systems that are in place that are run by the Pakistani government as well. So I think that because it is replicable, it's scalable, we certainly support it as well. And as we look at philanthropy, I think just people, and not just Pakistani diaspora, but I think generally people are getting very smart about how they spend their money, where do the dollars go, and how do you measure impact. And I think from all of those, I certainly see that this is one of the systems that fits into that bucket very well. And finally, I just wanted to say that Dr. Sania is a force of nature, and she's a role model to me personally as well. And I like to joke that when I grow up, I would like to be like her. So, and if we can have more people like her in Pakistan, I'm sure we do, and we can collectively sort of provide them the resources and support that they need. I think Pakistan could be a much better place than it is right now. Thanks.
I think your closing thoughts are, we share many we all share your thoughts, and thank you. One of the things I've been thinking of, and Chris, you've talked so much about the diaspora, we need to convene the diaspora, especially the Pakistani American community that is so prominent in the health sector. And we need to figure out how to mobilize them more effectively. So I look forward to, as we engage in the conversation that will begin shortly, your thoughts on how, and Chris, yours as well, how we can get into some granularity on how we can mobilize that diaspora more effectively to support Heartfile financing and some of the other health projects that I think have really been identified by PNB local chapters as really targeted priorities. It's something that we really feel is ripe for opportunity, and we need to translate the ideas into reality on the ground. And I know Sania, we've been trying to make many connections for her, but now we need to really build that piece out. Sania, if you'd like to introduce our last panelist, and then we can begin a conversation.
Yes, indeed. Our last panelist for this morning is Mr. Hamid Jafar. Mr. Jafar is based in Karachi. He comes from a very eminent family, and I think one of the most bona fide and one of the most successful businesses in Pakistan he has run for the last many years. He's retired for the last several years, Hamid, correct me if I'm wrong, a few years. And he's committed himself to health philanthropy ever since then. Both he and his better half, Tasneem Jafar, who's right across, you want to raise your hand, Tasneem, are big time into philanthropy, and they bring a lot of flavor, a lot of passion and personal interest and transparency into philanthropy and social work. Hamid was one of the very few first people who helped me in this effort. Not only is he a donor into the system, and I look forward to him sharing his perspectives about being a donor in the system, but he also gives me advice about things that I know very little about, managing money. And I look forward to deepening my collaboration with both husband and wife. So I'm thankful to both of them. They've come all the way from California for this morning. Hamid.
Thank you, son. Good morning and assalamu alaikum. We were vacationing at Lake Tahoe when Sania inquired by email if we would attend this event. There were no plans to visit DC. It was very flattering for me to be invited to come witness progress of God's work while we were enjoying God's country. in California. Little did I know that I would be asked to address this August gathering convened by one of the most prestigious institutions of USA. Thank you, Tony, for inviting us here and being part of something which is very important to us. I'm truly honored. A few years ago, Sania initiated Heartfile health financing as an entry point to reforming Pakistan's health system after the publication of Choke Pipes, the roadmap for reform of a developing country health system. In June 2010, our family trust, the Soleimania Trust, became the first institutional donor to support HHF. Sania invested her own money and a lot of executive time with a team and software engineers to develop a transparent system that validates poverty and prioritizes deserving patients. Much of what I had to say has already been displayed, and I'll cut that out, so the commercial will be a little shorter. There are quite a few charities in Pakistan providing healthcare support. What is so unique about HHF? Well, the validation and priority setting process of a poor patient is seamless and instantaneous. As a donor, I feel empowered. I'm connected to each patient, and I feel as if I'm giving it directly to that donor and not giving to an institution, and which is something very important for people who give zakat, which is an individual contribution, not an institutional one. This is a unique way of being connected with the recipient so that you know where your money is going to a deserving patient, which I think would be important for many of the Pakistani community here. I have access to the patient contact details, and I know what overheads are being charged, which most charities are very silent about. In effect, it is just giving to the patient yourself, and it's transparent. Now, the need is enormous. The burgeoning uninsured population has nowhere to turn to for healthcare reimbursement. This is where Heartfile is filling a strategic priority need, and this is why this project will, to my mind, upscale fast, and it needs the support of the global community. And something that was said earlier about partnerships, it is very important. The merit of this system and its relevance to the health financing needs of informal populations has been widely recognized. HHF model was selected for inclusion in the World Health Organization report of 2010. It is a featured Clinton Global Initiative commitment, and last year Sania was awarded the prestigious Global Innovation Award based on this work. Sustainability of HHF is dependent on its key component, the Health Equity Fund. Last year, Sania received a monetary award in recognition of her work from the Rockefeller Foundation. And I was truly humbled when Sania decided to invest that reward in an endowment fund to serve HHF. As a result, the Rockefeller Foundation launched the Sania Nishtar Fund in New York last July. We have contributed and will be contributing as a trust, and one of my tasks is to help raise funds for this fund so that it can serve, the income from this fund can serve the needy. She invited a select group to the oversight committee to help broaden the fund base and ensure the fund gives an adequate return to meet the colossal requirements. I'm one of the 3 members. We are in the process of laying down the ground rules and are planning the steps ahead. We are also exploring ways of engaging physicians in America. As the fund will grow in size, and I have no doubt that it will, persons with expertise of managing funds internationally will be entrusted with this task. It is right now with jokers like me, and she's giving me credit for it, but I think we will be seeking support of international fund managers for this. In conclusion, I'd say a credible and transparent vehicle exists in Pakistan that serves the catastrophic healthcare needs of needy persons, currently in Islamabad, but with time it will grow and sign up partner healthcare providers in other cities and extend this service. In the process of creating HHF, Sania established a number of partnerships. Today, she's giving a more formal structure to those partnerships by creating a Heartfile Leaders Network. Leaders can support Heartfile financing and the Sania Nishtar Fund in many ways, by advocacy, donations, supporting in the field, volunteering. There are many students that come from the Pakistani community for summer vacations and come and volunteer their time to education and healthcare support. And that is also something that can be useful when they come back and spread the word here within the community. There can be many supportive and helping roles that individuals can play. For now, our appeal to the leaders is that of mainly advocacy to spread the word within the global community so that more people become aware of HHF and they can avail the opportunity of contributing towards it should they wish to. Thank you for your time on a Monday morning, yes.
Thank you very much. I think we our panelists have put a lot on the table. And Sania, if it's all right with you, I'd like to open the floor for conversation and to have a dialogue with those in this room to try to advance the conversation further and figure out what might be appropriate for some next steps and how we can anchor this partnership and figure out what might sort of where we see opportunities for partnership, action forcing events. What are some opportunities that are coming down looking at the calendar? I think, Sir George, you mentioned a CGI. Actually, usually Chris and I are pretty up to date on CGI, but June 25th, I'm obviously aware of CGI in September, but what might be coming up in everyone's respective calendars that we can advance Heartfile. You also touched on, and I'd like to get some further conversation on opportunities for volunteering, that American students who are in Pakistan might have the opportunity to actually work and be a part of the Heartfile. And Sania, you may want to expound on that in a little bit more. And I know we have some material that's been provided. But I'd like to open the floor and entertain some further conversation, and like to keep it informal so that we can have a conversation and try to come away with what I like to call a little bit of an action plan. So may I please, does anyone have some questions? Some ideas that we might, Awas?
No, I was just going to I just want to make a quick comment about the system itself. That the one point I forgot to mention was that not only is this system in Pakistan, but I think it's easily replicable to other countries where it's needed as well. I think the infrastructure actually does exist. So in the future, it actually could be taken to other places. And not only, and correct me if I'm wrong, Dr. Nishtar, but not only, I mean, it's a social protection tool, so not only could it be applied to healthcare, but to other social mechanisms as well in the future. So it's a core piece of technology and infrastructure that she has built, and which is easily scalable and replicable to other areas as well.
I think that's a very good point, and the whole innovation piece, needless to say, we're sitting here at the Aspen Institute, and as you know, Walter Isaacson has published the Steve Jobs book, so we are deeply embedded in the whole issue, and have been prior to the publication of that book, on the issue and relationship of ideas, bold ideas, innovation, and thinking outside the box. So I think I have been struck by that too, and I think that we are at the point of looking at Heartfile as a proof of concept. I would like to see it anchored a little bit more in Pakistan, and one of the questions I have, and I'm just looking, Sarah, who has done extraordinary job. My colleague Gabe, who also works on Pakistan, but was just in Indonesia and returned over the weekend. But Sarah, we are deeply indebted to you for all the work that you also do on Pakistan and for putting this together. But Sarah put in my file a recent article in the Daily Times, and I wanted to pose this question to our panelists and also ask my colleagues here. So one of the issues in Pakistan is that the government does not, the two issues. One, they do not devote enough of the GDP for healthcare, which is the obvious, we know that. But they also have set up a system where the rural areas, and when you have to go from rural areas to cities, which then compounds the already existing problem in Pakistan. And so you have to go to city hospitals, and the transportation and getting there, and it just compounds things. How does Heartfile, when you look at building out Heartfile, how do you see this issue of looking beyond and building out from urban areas to the more rural areas? Is that something that you're thinking about, and what needs to happen to get you to that next step, Sania? And my colleagues, I mean, is that something that is a good idea or not such a good idea? And I would like to mention Robin Rafel, who is here. Robin, as I know everyone knows, is a Pakistan expert. Robin, thank you for being here. And I would like you to offer your thoughts as well. You obviously sit at a very important place where you sit today and where you were previously. So thank you for taking the time to join us today. We really appreciate it. But Sania, could you mention, what are your thoughts on that issue?
Well, I think one of the points that you raised, Tony, was about the envelope, about the size of the envelope and the percentage of money that was spent on health. I personally, from my analysis, feel that it's not the size of the money, it's the way it's utilized. Because there are huge and massive pilferages from the system, huge, unimaginable pilferages from the system. And in support of this, I'll cite an example to substantiate this case. Because there was an initiative in Pakistan where the management of basic health units, which is the primary level, was given in private hands. And that private agency had problem utilizing the money. They were just given a one-line item transfer, and they had problem with utilizing the money. So there's a massive issues of utilization, and of course the size of the envelope is very small also. But touching upon the other dimensions of what you said, this program has a context, and the context is that and I'm sure that Ambassador Raphael will bear me out, that you have to operate in an environment where much is crumbling, where the capacity of the state to deliver welfare and their capacity to govern, their capacity to target anything to its population has been deeply eroded. And there are many manifestations of that. There are many indicators to highlight that. Now, in that environment, what do? I was faced with a choice. Do I stay as a policy advocate for the rest of my life in an environment where there's no policy consistency, in an environment where there's no accountability of decision-making at the public level? There's no transparency in the use of resources, in the use of decision-making? Or do you dive in and do something and use that as an entry point to reform? And I try to do the latter. Now, I was confronted with challenges. How do I structure something? How do I drive a car while sitting outside of it? And how do I create something on ground which will have the potential to go to scale and which will have the potential to bring changes in different dimensions? So first of all, I started by accounting the strengths. So what are the strengths in the system? And one of the huge strengths is the nature of the people. The Pakistani society is very different from its government. The Pakistani society is very giving, is very resilient. There's a huge feeling of camaraderie and companionship. And my friend Tasneem Jaffer was telling me that the entire city of Karachi is running on volunteers and people's support. I completely agree with her. You walk into every school, hospital, charity, orphanage, the state system is crumbling, it is the people that are contributing and keeping it afloat. And in fact, if you look at a simple statistic, huge and massive tax evasion, but a nation that is on top of the world's indicators when it comes to philanthropy and giving, and West will bear me out on that. So, as a person with a slight interest in reform, I wanted to leverage the strengths, and one of the strengths is the giving nature of the people and their willingness to contribute as volunteers. That's one. The second strength of our system is the pervasiveness of technology, the technology infrastructure. The third is the pervasiveness of mobile phone use. So we have in a population of 180 million, we already have 120 million mobile subscribers. That's a huge strength, a huge strength. Then, of course, another strength is the National Database Registration Authority, which now has personal details of at least another 120 million people. So for me, I tried to join the dots. I said, how can I leverage people's time, money, and how can I use technology as a lever, map it with mHealth, tap into the database, and create something which has the potential to go to scale, something that will both meet an urgent humanitarian need, but something which is systemically well-grounded so that it's built for scale. And of course, as a person with an interest in health systems, I thought if I could use that lever for financing, then use it as a pitch for quality improvement in the health system. So initially, we just started it as a financing platform. Now we're using that platform as a conditionality for improvements in health sector. The next step for me is to use that for an accreditation system. And in the process, there is workers' accountability being being institutionalized. Of course, it improves governance, it reduces pilferages from the system, it boosts donors' trust to contribute. And our next contributor in this was the Pakistan Poverty Alleviation Fund, which is partly World Bank and which is partly the government of Pakistan. So we'd like to run our money through this. We did a first pilot, we're in the process of upscaling. Now governments themselves have started getting interested. One of the provincial governments want to come in as a donor and wants to mark its own hospital. So what was created was very, very simple. It just leveraged the strengths. This is no rocket science. It just leveraged an opportunity, and it was a whole designed for a whole. So the Pakistani system is a British NHS-style health system which doesn't work, in which there are pilferages at different levels. And all that we did was that we designed a round peg to fill a round peg, which is why there's an acceptability, which is why scale up is so easy. And to Aves's point, yes, indeed, because this matches money to need. Today we're using it for health. Tomorrow you can use it for cash grants to girls for education. God forbid, if there's a disaster, you can configure it within a couple of minutes to give cash grants to people. So the potential to use it is enormous. And again, on Aves's point, it is very suitable for covering informal populations in different parts of the world. In fact, when in WHO, when ministers hear about it from Nigeria and from Ghana, they're wondering whether I designed it for their country because it's so relevant to their needs. But I completely agree with Tony. Our first motivation is to deepen its imprint in Pakistan, to test it well. For me, as a person with a little bit of interest in reform, I think the best reform is a reform in which you have the will to learn from evidence. So you put the best thing in place and you do not follow it through, you do not improve it with evidence, it's going to fall apart, as many things have done in Pakistan, and I see people around the room with whom this may be resonating. But you put the worst reform in place and you have a commitment to learn from evidence and to modify and to continue to scale it, and it will work. That's exactly what we're doing. This iteration with which we're working is quite different from the one that we started with. And we're continuing to modify. So we're now shifting to money through mobile payments. We're shifting to a next generation of financing which takes into account loans instead of health grants, which makes it a lot more sustainable. And I'm so deeply humbled because this is something that I believe will work. there is a genuine need. There are informal populations all over the world who cannot be covered by insurance. So it is a supplement to health insurance. And both of them have their own place. Both of them are synergistic. I've slightly deviated from your questions, but to come to your last question about urban and rural, in Pakistan, there is this huge urban and rural divide. But as far as healthcare goes, when people in the rural area fall ill, and if something at the basic level cannot be dealt with, they will just sit in a taxi and come to the big city. So even for things that you would consider are primary, so the boy whom you saw in the video had a simple fracture of the leg. The other had a simple wound on her chest, which could have been treated at the secondary level in every civilized part of the world. Similarly, the third one didn't have a very sophisticated problem. But the capacity at the basic level, especially at the rural level, to deal with these problems is not there. Now, I'm not saying that there is no need to tackle it, because there are several facets of reform, and there's need to tackle stepping up of capacity at the basic healthcare level. But whilst things will be the way they are, these people will rush to urban centers. When they come to urban center, the issue is not an issue of service provision. The issue is of access to finance. And that is what we're trying to address. If I have your permission, Tony, for one more minute, this platform is also being used in a foreign policy dimension, which might be of interest to you. Because when I started working in Peshawar, which is where I and Mr. Mahmood come from, I realized that 30% of the very sick people in hospitals there were actually Afghans. They were not Pakistanis. Because in Afghanistan, which is just across the border, the problem is also of service providers. There are just no service providers. So if they break a leg, if they have a serious operation, require treatment, they will run to Peshawar and they will run to Balochistan. So we're using that platform, this to help those patients as well. But this could be a huge goodwill building gesture between the two countries. On the other side of the border, and with my other peace hat on, as co-chair of the Aman Ki Asha, which is a voice for peace, it's an initiative between India and Pakistan. As co-chair of the health committee there, we are registering Indian hospitals so that Pakistanis who cannot access treatment in Pakistan can be referred across. So the potential for using this, both in terms of a systems intervention to bring transparency in the use of money, in strengthening governance, in bringing HR accountability, in mainstreaming quality, is immense, not just for health, but in all other sectors. But beyond that, for me, it is also a foreign policy bridge, at least between these three countries that have adjacent borders and have something to offer to each other.
Thank you. My name is Susan Finston, and I appreciate the opportunity to be here today and to learn more about what Dr. Sania is doing. I'm the North American consultant to the OBS Group, which is Pakistan's fastest growing and largest, indigenous multinational pharma company. The CEO is a Canadian Pakistani dual citizen and had a lot of multinational experience before coming back to the land of his family to start the OBS Group as a management buyout from what was then Organon Biosciences. I just wanted to add one other positive point about the assets that Pakistan has, which you alluded to, which is partly because of the British heritage in healthcare. The healthcare providers themselves, outside of the state systems, are not only top-notch, but they by and large have their certifications in continuing CLE either in the US or the UK, and they are integrated into the Commonwealth system for education. So you have institutions like Aga Khan University, Shaukat Khanum, and others, DUHS, Dow University Health Sciences, all of whom are in relationship with the OBS groups, integrated but autonomous clinical research unit, and is part of now PNB looking at those kinds of programs. So I have been to Karachi to visit at DUHS and been engaged by teleconference, et cetera, with other of the professionals that have ongoing relations with NCI. So in terms of the professionals and the fact that the language is English, not just language of science, but legal language of healthcare and consents and all of that, it is an enormous asset that I think is undervalued for public health in Pakistan, and it's a reason why where you add the transparency and the accountability through e-government, which across the three countries, India has, as you mentioned, enormous experiences to benefit from this. Whenever you have e-government or e-systems, corruption automatically goes down 30–40% because of the antiseptic benefits of sunlight. Okay, not just in medical terms, but political terms. And that's something Sam Petroda has been very active in India, and I hope that we could bring that in if we're looking across borders. But in terms of the underlying strength of the healthcare system, it is very strong. It just doesn't have the glue that it needs to bring the maximum benefit to patients. But we have really wonderful health professionals, and I think that that bodes very well where we can create these connectivities with the e-structures that promote the efficiencies. And then we just have to get those who have the funds, and we know they are there, to listen and to pay attention to the success stories and to contribute to their broader benefit for the common man and woman in Pakistan. Thank you.
Thank you, Susan. Yes?
First of all, I would like to congratulate...
Could you just introduce yourself, please?
Certainly. My name is Mahmoud Ayub. I'm a consultant now with the World Bank and from Pakistan. Just wanted to congratulate Sania for really tremendous work that she's doing. And I don't want to go into any more details, but just to say that I'm delighted that someone is doing this work that needs to be done. What I would like to stress, though, is that, just like Chris mentioned, that we have to be a little bit more risk-taking and take bold initiatives. So looking at the work, the scope of the work that is being done by your group, I sensed that it was focused mainly on Rawalpindi and Islamabad, which are the better off places. Are you doing any work at all in the tribal areas where obviously the need is 100 times more? The poorest of the poor live over there. Even the ones who are better off are much better than Majid in the film that we saw. So would like to know your views on that. Thanks.
I think Sania would prefer we cluster some of the questions, please.
My name is Dr. Rosina Mistry, and I work for Aga Khan University, and I'm also the Director of Community Health for Aga Khan Health Service. I'm, by the way, the Eisenhower Fellow also. So, Sania's work is extraordinary, and I mean, like many of you who said today, we all are inspired by what she's doing over there. And I, just building on the earlier comment, I'm thinking we have a very large network of health services in rural areas and in tribal areas, in Chitral and in northern parts of Pakistan. And we have secondary care hospitals. And one of the challenges that you have identified is the fact that it is often expensive for people to reach urban hospitals and also to get treatment for the conditions that can easily be managed at the secondary care hospital. And I would say even prevent, like in case of TB that I saw over there. So I think that, the next task actually when we go back home would be to actually see how we can actually connect, our network with your system and to actually see that, people who actually can be managed more effectively at that level get the, support that you are sort of, piloting over there and see how we can extend the access of services in that area. But thank you for, sharing this very powerful model that you have developed.
My name is Mary Kane. I'm president and CEO of Sister Cities International. And we have two very strong sister cities with Pakistan, and that is Houston and Chicago. And getting back to what Chris had talked about, we are, these are usually bubble up from a diaspora community within the city that starts these on-the-ground local relationships. They are very driven to help the people in their country, the country that they came from. So anything that we can do to help you to spread the word, especially in places like Chicago and Houston. And we have the network we have that really local network that connects mayor to mayor, municipality to municipality, and small business to small businesses over there. So whatever, I would love to help you spread the word.
Thank you very much. I'd like very much to talk with you, and obviously, we know the mayor of Chicago from previous times, but I'd like to have him more embedded in not only PNB more broadly, but on this opportunity. I really appreciate your offering that, and it's something that I would welcome. Houston is very interesting for a number of reasons. It is a rich medical community, and I think it's something that we should be talking about in terms of next steps. And if I could just add a question, Mahmoud, you spoke to the issue of being a consultant for the World Bank. One of the things that I wanted to put on the table, we have just concluded a partnership with the IFC, and I would like to ask your thoughts. Is there a way and a role for us to do a partnership with the IFC to support this initiative? And just wearing your World Bank hat, you know, I know it's a different lane, but if maybe you could think boldly and offer us some thoughts that we might be able to share with Sania while she's here, I think that might be very helpful. Are there other questions we could cluster for Sania? Yes, please.
Akhtar Hamid, formerly of the Pakistan Country Desk Legal Department, World Bank. Just a couple of questions. This is a brilliant initiative, brilliant. Just a couple of questions. First of all, how many people are you able to help on an annual basis? I mean, what is the extent of your coverage? And secondly, you have referred repeatedly to putting in place mechanisms for preventing pilferage from the system. What are these mechanisms, if any?
Sania, I think that's quite a few questions, I'm sure. Do you have a question? I can go after. No, go ahead, please. Yes. Please.
So, first of all, thank you very much, Tony, for organizing under this Aspen Institute. It's a wonderful initiative. And as I said, Sania last night, if we have one more Sania, I think we can fix Pakistan. So I will not say more than that. So my name is Atiq Mirza, and I'm one of the cardiologists from Connecticut. So Pakistani physicians have been engaged in dealing with problems in Pakistan at an individual level and at organizational levels for past many years. Association of Pakistani Physicians of North America was conceived and formulated in 1979 in Chicago, and since then there have been multiple initiatives, but we never had a good footing on the ground in Pakistan where we could deliver because of the poor infrastructure and all the problems you all are very well aware of. Apna has initiated Apna Sehat program, Apna clinics, at organization level and individual level. Individual physicians go back to Pakistan, help with the free, providing the free services. We take the medications, we take the equipment, and I can assure you that in past 15, 20 years, 25 years, we have delivered more than millions of dollars of equipment. First of all, I'm talking on behalf of all of them, I'm here as an individual, but knowing the system, so I'm aware of that. So I think here in America, you can knock at any door, physician's or surgeon's door, you will not be refused. I'm very sure about that. So reaching out to the physicians, because most of the physician community is not aware of Sania's work, I'm very sure. So engaging them at the organization and individual level, and reaching out to them with just thinking loud, sending Sania's book and a DVD, identifying the leaders in the community, and sending those to the physicians because we can find the leaders in each city and each state level, because there are chapters, there are alumni associations, and there are specialty organizations which are affiliated with the Association of Pakistani Physicians of North America. So first of all, networking with the physicians of America is very, very important, and creating an awareness. And I can tell you, most of the physicians they are desperate to find out if there is any transparent organization on the ground which can deliver and which can provide help, because we can provide finances, we can provide our services, but we cannot make our presence individually or organization level, personally, in Pakistan, because we are working here, we have families here, we have, we live here. At the same time, physicians of Pakistani origin have a significant presence in UK also, and they also have organizations which are, we collaborate and we, sometimes go to each other meetings. So tapping them and reaching out to them at organization level and at individual levels, that will also, that's the second step I will suggest in my humble suggestions. Then I will suggest that, forming a 503c organization under the umbrella of Heartfile, because people want to donate, but they want some tax deductions at the same time. And at this point, if we have, I'm not sure whether that system has already been in place or not, but if that system is in place, that will generate, because most of the physicians give zakat. Zakat is an annual donation which Muslims give annually in the month of Ramadan or throughout the year. So that's one thing. If we provide that vehicle to our physician community by giving a 503c organization, we will generate a huge amount of money. And at the same time, I will also suggest we are dealing with, this is what we are talking about, is all secondary prevention of the disease. At the same time, we need to pay attention to the primary prevention also, because if we are missing out the primary prevention, secondary prevention is going to be so huge task. It's going to be so big undertaking that we'll not be able to handle this unless we do something for the primary prevention. And in my mind, primary prevention involves the education of the health providers and education of the masses. If we don't do that, this secondary prevention is going to be out of our hands, and we may not be able to tackle it financially. So these are my humble comments, and thank you very much.
They are extraordinary comments. I'm going to ask Sania to respond to the collection of questions, and then we need to wrap up, and I will offer some concluding remarks. Sania?
Thank you for the words of encouragement and appreciation. I'm deeply humbled and very honored, and thank you for your comments, your very constructive comments. Tony is a very action-oriented lady and wanted this meeting to conclude with some action points. So there's a lot by way of action points on the table. I'll separate your comments into two. There are clearly some comments which are relevant to the action agenda. So the very kind commitment by Mary Kane from Sister Cities, and we certainly look forward to following up on with that conversation. Rosina's point about the potential to engage with the Aga Khan network up in the mountains is something that we need to look at very closely. And then, of course, Dr. Atiq's very valid points about the potential within engaging the diaspora strategically is something that Tony and I were already thinking about, but we really look forward to a partnership to flesh that in much more detail. The point about the 503c is something that I'd invite Hamid to talk about subsequently. So there is much by way of potential action, for us to deliberate, and some very clear avenues, some very potential clear potential stakeholders, and avenues for engagement. So I'll put this to one, and she requires insulin today, a blood test tomorrow, an X-ray the third day. We are configuring our capacity to be able to be responsive, and we're doing this through a very simple way. So SMS tokens in different colors given to eligible patients, where they go to different providers for whom there is no cost in punching the numbers. Because the alternative to this is the smart client mod, is the smart card model, which many countries have done, and our assessment is that there are costs incurred at the level of the provider in keeping that gadget. So we will try to obviate that by going to something very simple. So very valid point, and we are, as we progress with over the pilot phase, I will be in touch with a more substantive process of engagement. Mr. Mahmood's question about the tribal areas, and I'm glad you brought it up, that's an area where there's a huge need. In the current model, we're doing 3 things in that respect. Number one, even in the current model, the people from the tribal areas are a very substantial chunk of the recipients, because they're laborers, they're daily wage earners, they're not documented in the system, they don't have identity cards, they have no homes, they come and they sleep on pavements, they get their legs fractured, and they have nowhere to go to. So we are very responsive to them, number one. Secondly, we are registering some hospitals. One of the few hospitals in the Waziristan area, which the armed forces has helped build up, is a hospital that we're going to be registering, because there's some basic treatments that are done there, which we'd be very happy to support. The Pakistan Poverty Alleviation Fund has a specific focus on the federally administered tribal areas, and they've got allocated money. And in fact, last week I had a discussion with them on how to better utilize that fund through this channel. So let me assure you that they are very much on the top of our list, for reasons other than the fact that I speak Pashto, because they're the true deserving. Our colleague's question about how many people annually, and I was asked, I'm always asked this question, especially with partners across the table who want to help scale it up. And I could tell you that we have built the systems for scale. Right now, our current capacity is to deal with 25 to 35 cases a day. But the systems and procedures to replicate that have all been established. So in terms of the policies, the frameworks, the guidelines, I can even tell you what it would take to have another unit which will double our capacity, and I can put exact numbers on what it would take to quadruple the capacity or take it to 100 times. We've invested time and effort into that exercise, number one. And secondly, we have the huge investment that we made in technology has been built for scale. In fact, the people who were helping us build the technology kept asking me this question: why are you building it for hundreds of thousands of people? You are just doing a pilot. Why are you making this huge investment? Because somehow I had this feeling that it will grow, and I did not want to reinvent the wheel all over again. So both the systems and processes have been established, have been costed, and the technology which is supported is there. And of course, one of the greatest enablers is mobile phone, which is pervasive in any case. So the connectivity is something that is not of our making, that's available to us. The limiting factor is money, because when there is money, we can deepen the footprint, and it can be done very quickly. The mechanisms of pilferage, and I'm glad you asked this question. There are different aspects of this program in the process, in the technology, which ensure that it is, to the extent possible, is free from corruption. And I was telling a donor just last week, I was telling him, unless each and every of my team members are colluding, it is impossible to pilfer from this system. Because with the technology, as Hamid will tell you, a donor has a personal web page. So if you're giving a certain amount of money, and if 20 people have been supported, you are going to get personal itemized detail for every penny. So you will be told that $200 has been spent on treating this patient, and you will be given a certain set of information on the web through a password-protected site. If you want more details about that patient, if you want to see the barcode of the stent that was put or of the valve that was put, we can give it to you. We can give you the number of sutures that was used in a patient and the number of sutures that were returned back. So that's one level of transparency through the system of inventorying and archiving and donor transparency and linking the donor to the recipient. And I'm sure Hamid must have called his, his recipients at some point. A lot of people do call them just to validate that this has actually happened. Then, in terms of the process has been designed in such a way that there is separation of responsibilities. So the person generating the request for the patient is not the person who goes and verifies. And the person who gives the ultimate decision is different from these two. Then there are 3 levels of validation in the process that what has happened has actually happened. And we have, actually we've been through so many, it's like peeling an onion, through so many stages of learning. Because for us, it was a very steep learning curve. There really was no precedent. So we had to do things, to stumble, to find out that there was a better way of doing things. We worked with suppliers of disposables and of implants who have very extensive archives of how corruption happens. They even shared lists with us of doctors who expect a kickback versus those who do not. You know, there are shocking details. I'm privy to some very shocking details. And at a conference, I said, I'm ashamed to be a fellow of the Royal College of Physicians, you know, because of the practices that happen in our own community. So that information was very critical to exploring and understanding the levels at which collusion happens. Because for us, every time there is collusion, there is pilferage from the system. We get to, there's more in terms of transaction cost, and of course, there's money lost in the process. So that's one aspect of the transparency. The other huge world of transparency is with respect to targeting the right person, you know, eliminating the false eligible and the false ineligible, because these are the 2 avenues in which corruption happens in programs of this nature. This is a social protection program where you're giving money to a particular person, whether it's for healthcare, whether it's education, whether it's an income support grant, and you would know better. The principles are the same. And the avenues of pilferage are, number 1, in the handling of the money, and number 2, the avenues are in the targeting of the person. And I recall one particular remark of the technology vendor as we were signing off the Q&A. And he was telling me, he says, Dr. Nishtar, you are tying your hands with this technology. Are you sure you want to do it this way? I said, yes, I absolutely want to do it this way. Because every time even if I want to favor someone, the technology will keep a log of it, that I entered in the system at such and such time, I loosened the criteria to help somebody. And it will be there in the system forever. So to the extent that we could, we have designed it for transparency and for targeting, because that is what the problem is in this game. That is exactly where the problem is. And as I was telling one of the donors, unless my entire team is on board, which is close to impossible, it's not possible to bypass the transparency parameters. I'm quite confident about that.
If I may just add that Pricewaterhouse affiliates are doing not only the financial audit for HHF, but also the performance audit. So that means this entire system was validated by them before it was put in place. So Pricewaterhouse affiliates, Ferguson's, are doing it. On the 501(c), ideally if Heartfile had charity registered here and somebody credible was managing it, that would be the best thing. But till then, I have Shakil's nod, but the chairperson is Shimi Kidwai. We've had Friends of Pakistan as a registered charity here, and also the APWA, American Pakistani Women Association. They helped us raise funds and transfer to charities which have their own 501(c) registered today, like the Citizens Foundation, the school one. It started all here in Washington, D.C. Funds were transferred. Last month or last week, they raised $700,000 for DCF and that goes to the 5013C that's registered. Otherwise, during the earthquake, we worked with a relief agency in California, and that is partnering with us, a different charity, and they've been sending us 100% of funds received by check or transfers with the mention to be sent to this charity, which is a different one, Murshid Hospital. But if in the memo of the check it's mentioned, I have to ask them. I haven't taken their permission that they would do it for Heartfile, but I'm sure they would be, knowing. So I would pass that information to the Aspen Institute, and if you find doctors who are in a hurry to transfer their zakat for next month, we'd be
I would just add to that we at APF actually feature Heart Profile on our website and on newsletters and all of that, and 100% of the donations that go to Heartfile, 100% of that money actually that's donated for Heartfile goes to Heartfile. So we as 501c3 are acting and collecting donations for Heartfile.
I can't stress enough the importance of this issue. We helped facilitate this very point for our colleagues in Palestine. I am very mindful of, I like to tether the action plans with clear timelines, and we are looking at mid-July with the beginning of Ramadan. So as we look at translating and coming out of what I think was a very rich discussion, Sania, of some ideas. Awas, I think we need to talk with you, Gabe and Sarah and I, to see how we can partner more deeply with you in terms of the networking opportunities. And for one of the other things I would like to follow up on, and I touched on this, but for our colleagues who are physicians in this room, you have major medical meetings, convenings. And if you could give some thought and share with us those opportunities that are coming down the pike, so that while I take your point, I think it's a very good point, that Sania could provide either her book or her website. If we could marry a convening in which she could appear, there is nothing like having Sania, present the concept of Heartfile, because she is so, if I may, Sania, compelling. And we would, I would look for an opportunity also in the meantime for us to figure out how we might be able to work with you and build in an infrastructure and look at other opportunities, how we could fill in to help deepen this network. I think the time is right. I am impressed with the scalability. I also am impressed with the relationship, as you yourself have pointed out, on global health diplomacy and the immediacy of where you sit in Pakistan and its relationship with the Afghanistan-India peace. In terms of how Heartfile can be used. But I want us to be very tangible and practical, and I really appreciate, there was it's a very rich convening here. Elizabeth, I didn't have a chance to call on you, but I want you to know how much we appreciate your being here, and I'd like to follow up with you. There is, Pepsi's been very involved in a number of our Aspen programs, and we'd like to bring you into our tent if you, there are many, many opportunities.
We'd be delighted, and Dr. Nishtar has been an advisor to us at the regional and global level on public health. So
I'm well aware of that, so I'd like very much to have a
already.
chance to talk to you and have a better understanding of that nexus. But I have a sense of urgency in our work, and I really believe we need to support Partners for New Beginning in Pakistan and Sania Heartfile in particular. And I thank everyone for coming, and Sania, I thank you for giving the Aspen Institute another opportunity to convene your colleagues and those interested. I think it's really important for you to recognize that Chris Balderston and Robin Rafel, both of whom had to leave, it speaks volumes that they came and that they are, and I was talking to Chris on the margins, as I'm wont to do, in terms of pushing the public-private partnership. I did have the opportunity to talk to Cameron Munther in Istanbul over the weekend, and we were talking about you and Heartfile. I did mention, but I want to mention again, the internship piece, and that is available, and would like very much for our colleagues in the university community to avail themselves and to make sure we can help inform you on the internship opportunities that are available in terms of working with Heartfile, but also the medical community, so that we can help get that piece out, and your relationships with the university community. So that I think it's a really good opportunity, and we would like to advance that as well. But if I can, on behalf of the Aspen Institute and Partners for New Beginning, I wanted to say thank you to our panelists, but before I conclude, I want to turn the microphone to Sania. But I did mention I want to thank my colleagues at the Aspen Institute, Sarah Harlan, who put this together, and Gabe, and also Dima, who worked on this as well. We've all been traveling, which is a little unusual, but we've been, our small little team has been far and wide, so we've been doing, preparing for this with great interest, but Sarah has really taken the lead, and I thank her very, very much, and Dima for working on this event. But Sania, may I turn this over to you for concluding remarks?
Thank you very much, Tony. I really think that there isn't much left for me to say except thank you all. I'm so deeply overwhelmed by your hospitality, by your facilitative attitude, by your extending a hand of help and partnership to me. I truly am. And I take back these feelings and these reflections back to Pakistan. I'm particularly thankful to you, Tony, for your continued guidance and friendship, personal friendship. Sarah has been such a source of support in organizing this meeting. We've been in touch on a daily basis. Thank you so much. I'm very impressed by your organizational abilities, as I am by Gabe Ross's. We hosted another meeting at Rockefeller last year. And this is just the beginning. We will be deliberating on this. I look forward to your support and guidance as we flesh out the conversation further and concretize the next steps. You know, the internship program is a huge opportunity, which is something that is almost coming to fruition. Heartfile will be very pleased to accept interns routed through PNB, routed through the Aspen Institute. And as I said, this is just the beginning of the conversation. I'm so thankful to our leaders who are always there to support us. You know, Hamid, for your continuing support and engagement, and Tasneem, yours. Sir George, who has mentored most of us, who's a father figure for us in public life. Thank you for being here. Just your presence means so much to us. And Obes, who I hope is not very much younger than I am. Thank you so much, and until we meet next time. Thank you, Tim.